So Shirley, we'd like to sum up.
Well, I've just got a few things that I picked up from the day. I detected an enthusiasm from people for working together, all sorts of different ways. So consumers and professionals, and then between the groups and subgroups, NCRI groups and subgroups. I also thought there was a level of consistency about what kind of research is needed. Particular emphasis on complementary therapies and nutrition and so on, and also better understanding of side effects and late effects. And I also thought I detected some improved understanding between the consumers, patients, carers and the professionals in understanding each other's point of view, and certainly a desire for that relationship to improve. Thank
you very much, Shirley. If I can just make a few final announcements. Those who had posters will notice that they've been taken down because we had to take the poster boards down. You'll find your poster at the reception desk. We have applied for CPD, so you'll hear about CPD points. You've got your registration book in the conference bag. There are some spare conference bags, so if you want to take a conference bag or a dozen home, for some reason it was very cheap to print a lot. They're very useful for taking your lunch to work, you're taking your swimming gear to the beach. We'd like to thank the journals for those poster prizes, quite prestigious poster prizes that we got, and to say there'll be a prize for entering into the feedback. One thing that people have asked for is for sharing of email addresses. Certainly from the speakers, the contributors, but also amongst the delegates as well. And what we'll do is we'll email you all out, because we've got your email addresses, and ask you if you want to be on a list that's shared, because I think it could be the start of some further collaborations and discussions. So I just want to finish up with some thanks, and certainly want to thank everybody that's taken part today. This is our first ever UK clinical trials meeting for supportive care, and I think we've really set the agenda moving forward in the UK. And particularly want to thank all the different speakers. I'm sure some of them have had to go early, but all the people who've contributed to the talks in the morning, this afternoon, the chairpersons as well, all the people who've stood up here and made an important contribution. Lots of people helped with the administration of this meeting. It was about a year in the planning. So people from University of Sheffield, people working here at the Edge. We've got delegate management. We've had help from Sheffield Council with the hotel bookings, catering. We need to thank audiovisual support as well. Must thank our sponsors who've donated very generously with educational grants. Some of them have been here today, some have just given the money. So these are exhibitors and our sponsors. So many of them are the commercial firms we've been talking about. So they've certainly supported us today. Logistics, as you know, we're being filmed today, and you'll be able to see the film, the DVD, not the DVD, the YouTube web link we'll send to you. I'd like to thank the organising committee that have worked with me over the past year, members of the CRI, NCRI, CSG, and also from locally in Sheffield, particularly the Consumer Research Panel. We really appreciate the work from the panel that we've had from Leslie and others, from Shirley and others. A lot of input from people just generating ideas, and then today, lots of behind-the-scenes activity supporting. You've heard George with his Centaurian voice moving people along, but lots of other people helping today. Really want to thank all the delegates for coming along with your posters, for your discussions, for your contributions, and helping to sort of draw a line in the sand to say from now on we're moving forward with the agenda. And I just want to make one final thank you. And Laura, would you mind just popping up here? No, Laura. Everybody has been receiving emails from Laura, some of you several times a week, and Laura has made a massive contribution to the success of this meeting. As my PA, and certainly as the person that's really held this together, I think you'd all like to thank Laura for her fantastic work, and I'd like to give you this, Laura. So thank you so much. Okay, thank you. And it's not the last you'll be hearing from Laura.
And I'm just muscling in here because I think there's one other person that deserves some thanks for today. I have to say the energy and the enthusiasm in this room from everybody here has been truly remarkable, and I'm going to leave here very optimistic indeed about the future of supportive palliative care psychosocial research. I think we as a nation have a good history of research in difficult areas that other countries have been less active and less good at addressing. And I think actually what I'm seeing here is the energy to actually move up another gear. And actually, Sam, you have been superb at being at the centre of that. I'm very encouraged indeed. Delighted to have appointed Sam actually to welcome him to his new role on the network as well as on the NCRI. So he's got yet another hat on his head. And I'd like to thank you for your energy and your enthusiasm in getting this meeting going today.
Thank you very much. Thank you. Okay, so that's evaluation forms. Pick up a spare bag on your way home and have a good journey home. Thank you.